going to go ahead and call this meeting of the Humboldt County Board of Health to order. This is Thursday, October 29th, 2020. It's 9 a.m. First order of business is roll call to determine whether or not we have a quorum. It's my understanding that Commissioners Tipton, Cherry, and Brissenden are unable to join. So is Dr. Stringham available?
Yes, I sure am.
Great. Sheriff Allen, I know, is on.
Good morning.
I believe Mike Bell is on now. Commissioner Bell?
Yeah, good morning.
Okay. So it appears that we do have a quorum, and there's 4 of us. So, and Commissioner French, I'm going to go ahead and chair this meeting today, absent Commissioners Tipton and Brissenden being available. So, first order of business is Pledge of Allegiance. Would you please join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Next item on the agenda is public comment. General public comment is designated for discussion only. The public has the opportunity to address the commission on any matter not appearing on this agenda. However, no action may be taken on the matter raised until the matter itself has been specifically included on an agenda as an item upon which action may be taken. Is there any public comment this morning? Okay, is there any public comment on the phone? *6 and identify yourself for the record. Not seeing any public comment. We're going to move on to the next item, which is update from Public Health Officer and Local Emergency Manager and Officer on the county response to the COVID-19 coronavirus. This is a presentation from Dr. Charles Stringham, Public Health Officer, Captain Sean Wilkin, Humboldt County Sheriff's Office, and Local Emergency Manager, and Nicole Maher, Public Information Officer, regarding the current status of Humboldt County response to the COVID-19 virus, including but not limited to the latest number of positive cases in the county, as well as updates regarding other efforts to mitigate the spread of the virus. In addition, the group may update the board regarding the dissemination of information to the public through various methods. This is for information only. So Dr. Stringham, you're first. Good morning.
Good morning to you. Is the sound quality okay? Can everybody hear me all right?
I can hear you fine, sir.
Excellent. So I'd like to begin this morning's comments with a disclaimer, which is kind of an unusual way to start things. But I normally like to emphasize and kind of celebrate the things that we can do and stay away from some of the negative issues. And this morning I'd like to kind of elucidate, maybe to define some of the obstacles that we're up against. And but I promise to end on a happy note, because we do have some great solutions and things that that we can all do that I think are going to help us out. We're facing some unique challenges, not only in Humboldt County, but also all throughout the state of Nevada, the United States, and indeed the world. And I'm trying to weave in a lot of the things that are going on, not only here in the United States, but also throughout the world right now that people are dealing with. So in terms of Humboldt County's cases, when we visited last time, it was 2 weeks ago, we had 152 cases that we diagnosed so far in Humboldt County. And at this point, as of yesterday, we are now at 177. So there's been a 25 patient increase in the number of cases. I'm very worried about this. I know we all are. And there are some things I'd like to do to kind of talk about why I think this is happening and some of the unique opportunities that each of us have to be able to eradicate this virus and do the things that we've been attempting to do all along. So the first is that in terms of setting the stage, what's going on here in our community, the state of Nevada has defined us as an accelerated risk at this point based on some of the numbers that we have, and indeed the numbers that we have are climbing. And the other thing that really bothered me quite a lot is that at Humboldt General Hospital during an administrative huddle held several days ago, a number of people expressed what I think are very legitimate concerns. I'm worried about them too, that some of the hospitals in Reno are starting to become impacted. And the concern that many of us have is that we may have to look for alternative places to send patients in the event they become ill here in Humboldt County. And so for anybody who's not yet engaged in these solutions, the things that we're working on, understand that this is a very real risk and that community leaders here in Humboldt County are working hard to mitigate this risk. And we absolutely need assistance from all community members. It's very, very critical that we have that. In terms of the United States, see a tremendous number of cases across the United States. Dr. Tony Fauci gave what I thought was a very impassioned plea to the American people, and I think that it's time for all of us to engage, no matter where we are politically, in or intellectually, or from a science perspective. Whatever your position is, it's time for everybody to engage. Around the world, the countries of France and Germany have decided that they are going to essentially close. Many businesses are closing. People are going to be remaining indoors, and they're attempting to get a handle on the dramatic increase in number of cases that they have. So this is not an issue that's unique to Humboldt County, although there are some things that we're seeing here in Humboldt County that are giving us unique challenges, and I'd like to talk about those a little bit next. So to set the stage, this is a world problem. It's a problem in many, many different countries. And but here in Humboldt County, I think we're facing some unique challenges. And so we'll talk about those next. I think we've talked previously about the burnout and the viral fatigue that's being created. I think a lot of people are growing weary of some of the things that we're having to do, the liberties, the freedoms, the various things that none of us really want to do, but that many of us are doing because they're the right things to do. But over the weekend, I wrote an article on Facebook in hopes to kind of bring people up to speed on what was going on the front of vaccinations, and the gist of the article was I was hoping that we could have people just re-engage and not feel as burned out, and hope that they would maybe take solace in the fact that there will be a vaccination soon, and that we can really all try hard to make sure that we're not infected before that happens. And to be honest, I saw something that I have not seen before in our community, and that was a tremendous amount of anger. The article was met rather than with thanks and understanding, and it was met instead with quite a lot of defiance and anger. There were a lot of opposing viewpoints that weren't presented in an intellectual way, but rather than a slashing, biting type of a way. I was really surprised by that. So I decided, as a scientist, to reach out to some of the people who had written some of these comments, because I wanted to truly understand how people are feeling about this. I think we've all kind of made the assumption that people are burned out and that people in general want to do the right things. And I think most people do. But I really wanted to understand the position of some of the people who are being defiant and are saying things like, I'm not wearing masks. There's nothing you can do to force me to do this. It's just like the flu. It's not that big a deal. Get off my back. And I think that the bottom line is that there are quite a number of people out there who are feeling this way. And I want to justify why they're feeling this way. And then I want to present the solution, the way that I think we can all kind of come together on this. So the justification that a lot of these people are using is that the lethality rates are still a little bit ambiguous. So when the virus started, it was about 6% of people who were passing away. And at this point, nationwide, it's about 2.5%. So the number is quite a lot smaller now than it had been previously. And while that's absolutely wonderful news for those of us in public health and everybody, it also is it's being used as justification that people don't have to engage, that this is really not that threatening and that it's not that big a deal. There are people who are indicating that the number of diagnoses is grossly misrepresented, and that there are far more people who've had the virus than actually have. And as this denominator goes up, the lethality rate goes down even further, which is justification for the fact that this group of people is refusing to engage. The other issue is masking, that masks are not extremely effective. I had a gentleman who told me yesterday, I can still smell perfume through an N95 mask, and that's proof that the mask doesn't work. I think that the bottom line is that perfume molecules are quite small and they make it through almost everything. Viral particles don't necessarily do that. So in a lot of cases, the science or the pseudoscience that's being presented by these people is defective, but it's still what they're subscribing to. And it caused me to think about a way that we could engage everybody. And so next, what I think is more positive. There absolutely is a way that we can engage these people. So far, what we've concentrated on is an appeal to people in order to take public health seriously and public safety seriously. But so far, what this board has concentrated on has primarily been the fact that every one of us needs to take responsibility for public safety and public health. But the problem is that this group of angry non-engagers is not compelled by that. They don't see this as being a threat, and they see us as being overreactors. But the one thing we can all agree on is that in order to bring everybody together, we're all going to have to subscribe to the exact same philosophy. And that's about the only way this is going to work. And I think what's most critical is that we shift gears and emphasize the one thing that we can all agree on. All of us want to end this pandemic. All of us want to get back to our lives to be able to do the things we enjoy. And I think the best way to do that is to emphasize the fact that through doing things the right way, we can end this pandemic. So maybe for the non-engagers, that won't be about public safety or public health, but rather a return to life as it is, as it should be, as we all want our lives to be. So it's the same call to action, but it's a different reason, a different motivation. And I think that needs to be the board's focus. I think it's critical that we continue to concentrate on public safety and public health. That's what we do. But at the same time, I think that the motivations need to be fine-tuned to emphasize what we can all have if we do things the right way. It's a subtle difference, but I think it's an important one, especially to this group of individuals who refuses to engage and is becoming increasingly angry. Next, I'd like to talk a little bit about the FAST team. Very happy about some of the changes that are going on. We have responded to an escalating threat by doing two different things. First, we've brought on two new case tracers, contact tracers, and they're in various stages of being vetted. That process takes some time, and both of these members are in the process of going through that at this time. And the other thing that I'm particularly happy about is that we've had a number of cases, a number of subclusters, and some scares at the Humboldt County School District, and that both Dave Jensen and Dawn Hagnes, the superintendent and assistant superintendent of Humboldt County Schools, are not just involved in the FAST team at this point, they're actually members of the FAST team now. And so they're assisting us in tracing contacts and containing the spread at the schools. We've had a number of cases that each of us have worked together on, and I'm really very pleased about the way things are going. I see things promising that I think things are going to go much, much better in the future with all the increased communication, various meetings and things that we're having, and I'm very pleased to have them as members of our team. And as I said, we've already gone through a number of subclusters at the school and have contained some cases, and I'm very excited about the way things are working. So I think things are going very nicely with this. I'd also like to talk a little bit about some challenges that we all face ahead. We are definitely going into cold weather at this time. People are going to be moving indoors. A lot of events that people are hosting, gatherings, get-togethers, will likely still occur, but they'll occur indoors rather than outdoors. And that's going to produce a tremendous number of more risk, a number of increased risk in terms of the number of cases that we can potentially have to deal with. I'm very worried about that, and I would appeal to each of the community members to please socialize safely, to wear masks, and to understand that the majority of the cases that we're seeing are indeed spreading among peripheral family members and also among friends. So in general, this is not spreading in businesses. In general, this is not spreading in public sector functions. This is spreading at people's homes and various private get-togethers. We just are having a hard time as a community our thoughts around the fact that peripheral family members and friends can be health threats. So we just are not trained to see things that way, but I promise that's what we're seeing, and that's really where the majority of cases are coming from. Ironically, when we focus our attention on bar closures, restaurant closures, and various actions against businesses, we are not focusing our attention where these cases are actually occurring. There are logical things to do. There are reasonable things to do. It makes sense to do things like that to focus our attention there. But in reality, our data does not show that that's really where the problem is. And if there could be one action taken, problem is it's not enforceable. It's very difficult to encourage people to do this. But my plea to the community is please socialize responsibly. Please distance in your homes, not so much around nuclear family members, but around peripheral family members, visitors from outside the community, and cousins, aunts, uncles, grandparents, people who aren't part of your nuclear family who come to your home in order to socialize. You're not threatened by them. We don't wear masks when they're in our homes, and then we wind up getting infected. That's really the crux of this. That's where we need to concentrate our attention. In closing, I'd like to reiterate some things that I'd said during the first meeting that we had as a board, and that is that Humboldt County is uniquely positioned. We are in a wonderful position as a relatively isolated community, a very tight-knit community, and a community that I think communicates very well with each other. We absolutely can do some great things here, and we really can get back to our lives. And the way to do that is to have every single solitary person in Humboldt County decide that they don't want to live with this virus anymore, that we all are tired of this, and that fatigue causes us to want to move forward and have every single person do the right things to reclaim our lives and to get back to business as usual. So my plea to you, everybody listening in Humboldt County, is to please do the right things. Please put a mask on, even if you don't believe in one, just to be able to get rid of this pandemic. It's important that we all do that. Please socially distance, even if that's not really what you believe in, or even if it's not the way that you think we can end this. I promise it is. It's critical that everybody do that. And please wash your hands. Please be safe, everybody. And it's time for all of us to come together and do the right things, no matter how you feel about this. Thank you very much.
Thanks, Dr. Stringham. Did anybody have any questions for Dr. Stringham at this stage? Does anybody have any questions for Dr. Stringham? Dr. Stringham, this is Commissioner French. I had a couple of small questions having to do with the contact tracing and our protocols with regard to tracing suspect hotspots in the community coming from where we identify viral loads from the PCR sampling that's going on right now. Do you have much knowledge on that yet?
I want to make sure I understand your question correctly. So you're asking about our ability to identify hotspots, or some of those hotspots that we've identified?
Yes, my understanding is that that's ongoing still, and that we have identified some regions within the city that potentially are hotspots based on identified viral loads in the effluent water. And I was wondering, are we following up on those little regions within our city, or with identifying those areas, or are we waiting for the outbreak of the disease itself?
No, in fact, that's a great question. So the first is that the highest of the highest of the wastewater concentrations was approximately 2 weeks ago, and the wastewater that was sampled, I believe, on the 20th, actually showed a slight reduction in the caseload. So it was a reduction in concentration. In other words, the Ron Seeden Supply manhole cover, the manhole cover that's located in the area where that business is located, services a relatively large region, railroad subdivision, and Sunny and the Corey's area also. And so initially we had the highest concentration in that area, but then when we most recently checked, Alicia Heiser had indicated that the all of the manhole covers now have RNA from the virus, but it's at a lower concentration. So essentially what wound up happening was a high concentration in a single manhole cover. Subsequently, the next week went to a more diffuse concentration, a lower total concentration, but a greater number of manhole covers. So that was kind of one of the things that happened. There was a program that we put together in order to be able to reach out to all of the addresses, and it was put together through voter registration and other mechanisms. And we were able to reach out to people in those regions. Nicole Maher had written an expose that went out to everybody and indicated that we were concerned about safety and wanted to advise people in that area of the actions to take, what steps to take. And so those were the things in my understanding that were done. Does that answer your question?
Yes, thank you. I had a couple of questions as to whether or not we were tracking it along that line. And I think it's kind of reassuring that that technology seems to be tracking the infections throughout our community fairly accurately. And I think it's a great tool for us to use with regard, especially with our schools and whatnot. Also, Dr. Stringham, do you have much, could you report much on the prospects for vaccine development as well as distribution at this stage?
I can certainly talk briefly about that. First, I'd like to follow up on the question that you'd asked initially, and that is that I think that the wastewater program is an absolutely fantastic technology, and to really drive the point home, what I think it does best is if we can have a short period of time to respond to the virus, to ramp ups, we're able to do things that we wouldn't ordinarily be able to do. The primary thing is that Humboldt General Hospital and the emergency system, primarily through Captain Wilkin, we need to have time in order to be able to set up our auxiliary hospital Rampart and to be able to ramp up in order to be able to meet the demands in the event that we have a lot of hospitalizations. And this wastewater testing program really shines in that area. So it would theoretically give us the time that we need in order to be able to prepare for things, to call in additional staff, and to allow officials at Humboldt General Hospital primarily to be able to call in that staff and to ramp up on our ability to respond. So each of these things take time, and I think that's really where this shines. So it's a wonderful technique. So in terms of vaccinations, a lot of things that I can say. Ironically, the article that I wrote on Facebook was about that exact topic, and what I can tell you in a general sense is that we will have a vaccination. Period. I have absolutely no doubt about that. I think the specifics are what are being called into question: time courses and specific techniques and efficacy. So, to the extent that this is a venue in which we disseminate information to the public and come up with our general strategies, I'd like to keep my comments general about the vaccinations. First, I'd like to explain that there are a lot of people out there who think that vaccinations are never going to work. And the reason they think that is because the virus is mutating, and you theoretically can't vaccinate against a mutating virus. And I would remind everybody that number one, there's been one mutation so far. There's been a possible second, but so far we're dealing with the D614G mutation, which is the initial mutation from the original iteration of this virus. And I can tell you that it shares commonalities in the spike protein, which is the target of our antibodies that are used in the vaccinations. And I can tell you that D614G is even more susceptible to the antibodies that are produced, even more susceptible. It is more infectious. It's more likely that it will spread from one person to another as that mutation. but that mutation is killed more readily, denatured more readily by vaccinations. So critical that everybody know the vaccinations have the capacity to work, they will work, and we will come up with a vaccination. I can tell you that there are a number of different companies that have suffered setbacks, and that the popular media is really pushing those setbacks, kind of trying to emphasize the fact that this is not going to work. But I can tell you that it absolutely will. And the reason is because, number one, a lot of very, very intelligent people working on this. Number two, they've already proven that they can produce these antibodies, and that when you produce these antibodies, it does make a difference. They've already proven that it seems to be reasonably safe. And each of the various companies are in many of the different companies are in late third phase of clinical trials at this point. And so there is absolutely no doubt in my mind that we will have a vaccination. And my best guess would be that we'll start hearing some pretty good news within the next couple of months. So AstraZeneca, Oxford, Moderna, there are a number of other companies, Johnson & Johnson, quite a number of different companies that are doing some pretty incredible things right now on extremely accelerated time courses. The other thing I can tell you is that the good news we get will come from private industry, not from government. Government is involved in dissemination of the vaccines. It will be involved in safety, in regulation, in the logistics aspects, and that is absolutely critical to getting this virus to the right people. But the good news is going to come from the people who are working on these vaccinations. And from those people, we're hearing some pretty incredible things. I read about this on a daily basis, and I can assure you that that we'll have some great news on the vaccine front very quickly.
Great, thank you, Dr. Stringham. Is there anybody have any additional questions or comments for Dr. Stringham's presentation?
This is Commissioner Bell. Just one comment on all of that. I think a lot of the issues that we see having to do with people's response to masks and the not wearing masks is there's a whole bunch of what seems to be hypocrisy in the, you look at the NFL sports or baseball, you got 22 players on the field, all hugging each other and whatnot. In the baseball, everybody on the sidelines wearing masks and getting fined if they don't wear a mask, and it just doesn't make any sense, to a lot of folks. And so I think there's no consistency in that, and I'm just wondering why Dr. Stringham, maybe you could tell me that the NFL could have 22 players on the field hugging one another and get away with that.
I love your question, and yes, I Commissioner Bell, I'm happy to take that on. I think that, to me, the bottom line is, in life, there's always going to be hypocrisy. When we look for it, it's going to be there. Each and every one of us is responsible for the area and the people around us. It's critical that every one of us engage these people and ask those questions. It's important for me as a public health officer, and it's also important for each of you also as community leaders, and equally critical for every single person in our community to ask those questions, to walk up to somebody and say, why are you not doing this? Why are you not afraid of this? Why are you not engaging in this? And to be honest, if I were attending a football game, which I don't, I would ask that question myself. And I think that the answer that you would get is a momentum, that people are just not used to being approached that way. People are not used to being called into question. And but Commissioner Bell, it is time that we ask those questions. It's time that each of us take a leadership role for those people around us and call those actions into question, because it is just as dangerous. This virus doesn't care if somebody is an NFL player or if they're an observer. It doesn't really matter. And that's the whole point of this. We're trying to change the way that people feel about this. We're trying to change the way that people perceive risks and threats. And I know it's a funny example. I've used this example before. Most of us have learned over the years that when you see a gun, it means, especially in the hands of somebody who is angry with you, that you're in jeopardy. We don't get trained to see musical instruments as being threats. But this is almost as if you get to watch somebody get beaten with a trumpet, and the second time you see a trumpet, you realize that your life is in danger. People are not having they don't have the capacity to make that connection, and so we're seeing our friends, we're seeing football players, we're seeing leaders, we're seeing medical people, we're seeing all kinds of people, but we're not seeing those people as being what they are during this virus, a potential threat to transfer this virus. So, and really the question gets back to what we talked about with relatives. My uncle comes to town, and I don't see him as being a threat. The second day he starts coughing, and 4 days later I have COVID. I can't make that connection any more than I'm able to see a trumpet as being a threat to my life. But after a while, you start to make those connections. So those football players, when 22 football players hug each other on a field, what I see is a threat, and we need to call them out on it.
Thank you.
I think this is Commissioner French. I think we're dancing around one of the central issues of the hypocrisy of this whole thing is that probably one of the worst things that has happened with regard to this public health threat, in my view, is that it came on this country in the middle of a political cycle and a major election, and it has been politicized from the beginning. The media has politicized it, and we're getting mixed messages depending on which channel you're on, and people in general have really started to question what, the whole validity of this thing. And I think that's where the hostility comes from. I think that's where the fatigue, the viral fatigue, is actually coming from, at least for people that are approaching me at this point. And it's very sad because I believe that we have the opportunity to try to stop this thing, at least certainly with a minimal loss of life. And I worry that the media itself has blown this thing wide open and has created a general level of mistrust of the message throughout the country. So that's just my view. Anybody else have any other comments or questions from Dr. Stringham at this point? Not seeing any additional. Thank you, Dr. Stringham, for your report.
Thank you.
And we'll move on to Captain Sean Wilkin from Humboldt County Sheriff's Office and Local Emergency Manager.
Good morning, Commissioner French. Good morning, everyone. Captain Wilkin is not available once again, but he will be back for the next meeting. He's out of the area right now, but we've been contacting DEM, Division of Emergency Management in Carson City. They are not reporting anything new other than what the governor reported yesterday, which Dr. Stringham basically covered in his presentation, which is the state is seeing an increase of COVID cases. Something on the Humboldt County level, we do have a nurse now working 5 days a week in our jail. She is able to do rapid testing on our individuals who are being initially brought in after being arrested, our inmates on intake. So we're able to do some rapid testing on them almost on a daily basis, at least 5 days a week. And when somebody comes into the jail, they're immediately quarantined for 14 days. We're hoping that this rapid testing will free up some of our quarantine cells because they are getting full now. We are seeing higher occupancy rates in the jail right now. We're running about 37 inmates, which relatively is fairly low, but we used to run about 20 a day, and now we're seeing about in the high 30s. But this nurse is a definite benefit to not only the sheriff's office, but the community in general to try to help control this virus. And other than that, I'll open it up to any questions if anybody has any. That's all we have. Thank you.
Do we have any questions for Sheriff Allen? Any questions on the phone? *6 to identify yourself for Sheriff Allen on this at this point. Not seeing any questions. Thank you, Sheriff. We'll go ahead then and move on to Nicole Maher, who's our Public Information Officer, regarding the current status of Humboldt County response to the COVID-19 virus. Is Nicole on? Nicole?
Good morning. Can you hear me?
I can hear you now, Nicole. Thank you.
Oh, great. Thank you so much. It's great to be here with everybody. Well, over the past 2 weeks, our local key messaging themes have encouraged county residents to apply what they know in order to protect themselves and their families from COVID-19. That's based on what Dr. Stringham was talking about 2 weeks ago, that we're just not connecting what we know in our heads with our actions. We've instructed residents on imposter illnesses such as allergies, severe colds, and the flu that may mimic COVID-19 symptoms. We've urged residents to be tested if they have flu or COVID-like symptoms, because testing is the only way to distinguish between the two because of their multiple overlapping symptoms. We've shared about the City of Winnemucca's wastewater testing program and encouraged people to get tested at the first sign of symptoms. We've reminded residents to do the right things in order to curb Humboldt County's latest increase in cases. We've shared that some of the latest increase in cases may be due to coronavirus fatigue and asked residents to refocus on keeping themselves and others safe. We've instructed regarding the CDC's updated definition of a close contact. So before, close contact was marked by one consecutive 15-minute encounter within 6 feet of a person. Now the CDC says that spending a total of 15 minutes within 6 feet of an infectious person over the course of a 24-hour period constitutes close contact. And we have noted that COVID-19 is a dangerous disease, primarily because we know so little about it, and we need to engage our most strategic abatement efforts to fight it. So in the county, Dr. Jacqueline Bay, who's the health director at Fort McDermott, she reports that McDermott has 108 cumulative cases, so that's up 7 from 2 weeks ago. The majority of those were tested through Fort McDermott, although some of those have been identified through outside clinics. As of today, McDermott has conducted 1,257 tests. 102 people have recovered, 1 person has died, and the reservation has 5 active cases. Marcia Foreman, our community health nurse, continues to test asymptomatic persons with no known exposure. Marcia has conducted 60 tests, 58 negatives, and 2 results pending. Golden Valley, operated by Nevada Gold, is testing both symptomatic and asymptomatic mine workers and their families. 8 of our recent cases were diagnosed through that clinic, and Ridley's 10 of Humboldt County's recent cases were tested there. City of Winnemucca's, as Dr. Stringham mentioned, and Alicia will share later on, has launched an early detection system for COVID-19 that relies on the wastewater. And Commissioner French and Dr. Stringham talked about this, but we did let residents know that over the course of the may receive a notification either by mail or as a handbill on their door that notifies them of a possible upward trend in their vicinity and encourages them to be tested at the first sign of symptoms. So during that first, last week, we sent out our first notification. We mailed about, well, I know exactly how many we mailed. We mailed 750 of those notices, and a small team of volunteers posted just shy of another 300 at the apartment buildings and mobile home complexes within that manhole region. We want to give a big shout out to the Mucka mask makers who continue to provide cloth masks for our community. To date, the mask makers have sewn 7,678 masks. Those masks are in stock at Ridley's and Olson's pharmacies, or they can message the mask makers via Facebook. We are very grateful. And As you probably know, on Monday, COVID-19 Mitigation and Management Task Force flag tumbled for a high case rate per 100,000 over the last 30 days. So those dates would be September 26th through October 25th. We flagged at 211. We also got flagged for high test positivity over a 14-day period with a 7-day lag. That was for the dates of October 5th through October 18th, and we came in at 12.3% positivity. So on our local social media channels, as our case numbers have increased, residents on social media have expressed disappointment in those they believe are not acting as good neighbors. Others continue to share their distrust, as Dr. Stringham mentioned, in a possible COVID vaccine after such a short time. Some residents continue to inquire and push for herd immunity with a kind of let the chips fall where they may mentality. Others question the death rate for COVID-19. That seems to be a recurring theme, noting their belief that the death rate is not much worse than influenza. And by the way, it is. More people have died in the past 8 months than in the previous 5 flu seasons combined. Residents also have expressed great appreciation and confidence in Dr. Stringham. Thanked him for his service during this time. As he mentioned, he posted a very nicely written and very confidence-buoying article, which was met with some terse reactions, and that's tough to take, especially when his comments are so needed and he's so well regarded in our community. Residents continue to be supportive of the school district's efforts to mitigate the spread of COVID-19. I've gotten some questions over social media, people wondering how many of the COVID cases that I report are actually flu. None. Obviously, we're just reporting COVID. And there have been lots of inquiries regarding where to be tested. I received a couple of those this morning. Most people are looking for faster turnarounds, which unfortunately nobody can guarantee right now. And finally, speaking of hypocrisy, Dr. Stringham and I both have been accused a bit of that after some healthcare workers had a community event and where they were not wearing masks or social distancing, and unfortunately people assumed that Dr. Stringham and myself had a hand in the event and asked why we didn't stop it, why we advocate one thing and then do another. And of course we were not affiliated with the event, but we just want to emphasize that our message has not changed, and it does become a fairly redundant message, but I'm not sure that we can say it a different way. There is no amazing complex solution to this. The solution is just wear a mask, socially distance, and clean. And so that message will continue, and so we just want to reassure our community that we stand behind that message. On the state's social media channels, some residents said they felt that pressure on the governor to reopen the state has resulted in higher cases, and some wonder about keeping the state open. Others continue to wonder about the necessity for closing down certain businesses. Others share statistics on the decreasing number of deaths around the world, both as a celebratory point and also, as Dr. Stringham mentioned, as supposed evidence that COVID is not as dangerous as people are saying. Others are saying, and Commissioner French is right on, this has become so politicized, but others are saying that Joe Biden would lock down the country if elected, while others counter that millions would die if Donald Trump is reelected. And so a lot of feelings on social media about what will happen with the coming election. Let's take a look at our situation report. The state is just shy of 100,000 cases. We'll probably top that in the coming week. 97,479 right now. State is about 1.2 million tests performed. That's up 73,000 from 2 weeks ago. The state up 75 deaths from 2 weeks ago at 1,766 deaths. Humboldt, we are at 177. Still 4 deaths, which we're holding there, which is good. Washoe, boy, they're struggling. 12,797 cases. That's up 6,300, just almost 6,400 from 2 weeks ago. Up 18 deaths from 2 weeks ago. Clark, up 7,300 cases to 80,000 from 2 weeks ago. 1,506 deaths. That's up 48 from 2 weeks ago. Lander has really jumped. Lander's quickly ramping up. They're at 110. That's up 21 from 2 weeks ago. And unfortunately, 4 deaths in Lander now. Pershing, up 1 from 2 weeks ago. They're at 24, no deaths. And Elko continues just to struggle. 1,393 cases. That's up 281 from 2 weeks ago. And unfortunately, 3 more deaths. They're at 14 right now. So in other news of interest, Nevada is reporting nearly 900 new COVID-19 cases a day, positivity rate of 10%. September 1st was the last time the state's positivity rate was at or above 10%, just to give you an idea. So during the press conference that Governor Sisolak had yesterday, he said Nevada has found that about 25% of COVID-19 cases have been found through contact tracing, but that means there are positive cases out there that the state is not catching through contact tracing, which is an indicator of community spread. The governor also said that in this week's White House report, Nevada is in the red zone. The state is 22nd highest state reporting more than 100 new cases per 100,000. 71% of the counties in Nevada, including Humboldt, have moderate or high levels of community transmission, and 24% of counties are in the red zone. Nevada Coronavirus Task Force has called an emergency meeting today with Washoe County to address the county's plan to manage their surge. And this will be Washoe's 5th week being flagged for elevated risk. So the state released a draft of its vaccination plan Monday. The initial round of COVID-19 vaccinations will be focused on the populations most at risk, including healthcare workers, people at increased risk for severe illness, and other essential workers. Nevada expects to receive very few doses of the vaccine at the beginning, and the vaccination plan ranks categories of Nevadans by priority to receive the vaccine. Of course, there is no approved vaccine yet, but the governor said Nevada will be ready to distribute and administer doses when they become available. So Nevada, Washington, and Oregon have joined California's COVID-19 Scientific Safety Review Work Group. So this group will independently review the safety and efficacy of any vaccine approved by the FDA for distribution. Last week, Gavin Newsom, who's the governor of California, announced a panel made up of nationally acclaimed scientists with expertise in immunization and public health. Vice President Mike Pence has agreed to follow all COVID-19 restrictions during a planned rally today in Reno. The agreement with the Republican National Committee includes a 250-person cap and mandatory masks. And in related news, Nevada's Occupational Safety and Health Administration, that's OSHA, has issued 2 citations totaling more than $5,500 for noncompliance against Douglas County and ABS Aviation. The date of the citations was September 12th, and you might remember that was the same day that President Trump held a campaign rally at the Minden Tahoe Airport, had a crowd exceeding the 50-person cap. So So in international news, as Dr. Stringham mentioned, seen a lot of action, a lot of shutdown across the globe. Russia's government announced a nationwide mask mandate Tuesday to try to curb sharp surge in cases that began last month. In Europe is really struggling through a second wave of the coronavirus pandemic that's prompted countries to impose some shutdowns. France, for instance, topped 52,000 cases in one day this week. So just compare that to 85,000 cases in the United States. We have 5 times the population, so France is really struggling. Italy is seeing about 20,000 cases daily. Spain has declared a state of emergency. UK, Poland, Germany, others are also seeing a sharp rise in cases. As of Wednesday, the most recent data available, statewide hospital occupancy rates are at 72%. That's down from 74% 2 weeks ago. ICU, 60%. That's up from 59% 2 weeks ago. And ventilators in use are at 25%. That's down from 30% 2 weeks ago. And it appears U.S. consumers are looking to stockpile goods and essential products again. So we may see some bare store shelves. Hygiene products are topping the list, along with toilet paper, hand sanitizer, canned goods, disinfecting wipes, and paper towels. Those are no surprise, but unlike the first stockpile, shoppers plan to also invest in frozen pizzas, pasta, snacks, and cleaning products. Frozen pizzas made me laugh. And a new study suggests that getting a flu shot may reduce the risk of COVID-19. So the research comes from a Netherlands team. It was released as a preprint that has not yet been peer-reviewed, but it indicates that a flu vaccine against the influenza virus may also trigger the body to produce broad infection-fighting molecules that may combat the coronavirus. So the paper is in line with some other recent studies published in peer-reviewed journals that point to similar effects. But of course, researchers caution that the research is preliminary and needs to be bolstered by more rigorous experiments. And just to give you an idea, as Dr. Stringham said, since the 1st of October, last couple of weeks ago, I told you what our cases had been for each month. So far in October, we've had 48 cases, and that rounds out to an average of 1.65 cases a day, which is the highest average we've ever had. That's all I have. I'm happy to answer any questions.
Thanks, Nicole. Are there any questions for Nicole? Any questions on the phone? *6 and identify yourself for the record for Nicole. Okay, thank you, Nicole. It looks like everybody is on board, so I appreciate it.
Thank you.
Okay, we're gonna move on to the next item, and I'm gonna have Dave Mendiola handle this. This is an update from Humboldt General Hospital on COVID-19.
Thank you, Mr. Chair. Dave Mendiola for the record. I'm happy to introduce two ladies from Humboldt General Hospital, Leanne Cushway, who's the Chief Nursing Officer for HGH. She is on the phone, and also Janet Sturtz. Janet is the infection preventionist for Humboldt General Hospital, and I believe Janet is going to provide the update for HGH. So I will turn it over to you, Janet.
All right, hopefully you can all hear me. Yeah, this is Janet, infection preventionist at the hospital. My presentation is not nearly as long because this is my first time. I knew you guys were all interested in the lab antibody kit machine that we're installing. I do have an update on that. It's still in the process of being installed. The vendors were here this week working on it. According to the manufacturer or the vendors, they told me it's 2 more months before we're going to be having that machine up to use. So that was not good news. We do have the screening clinic open now, Monday through Friday from 8 to 5 with lunch from 12 to 1. And there is a medical provider over there at this time. So it's much easier for patients to come in to be screened for cold and flu symptoms, tested for COVID. I know through the county, I get a lot of requests for rapid testing. Unfortunately, we're trying to get the rapid test through in at the hospital here, but it's just not happening. We still get kits through the state, and we've been trying to order them through Abbott, the manufacturer company, but they're all unallotted. They're only giving us 8 to 10 test kits a week. It is mandated by CMS that we test our long-term care facilities, so that's where most of our testing has to go. And based on county positivity rate, tells us how often we have to test over there. And with the rates going up, we're going to be testing a minimum of 2 times a week, staff, and it's going to end up going out to the residents. So that's going to be quite a few of our rapid tests being used. With the increase in the case in the county, the hospital has put no visitation back in place at the hospital. We just are trying to keep the patients and the staff here safe. The testing, because I hadn't given these numbers to Nicole for a while, so I do apologize to Nicole. We have tested 2,576 individuals through the hospital, and of those, 141 were positive for us. And that was my big, long speech.
Great, thank you. I appreciate the update. Is there any additional updates from Humboldt General Hospital? Is there any questions for any of the staff that would be making the presentation? Not seeing any. Appreciate it, and we'll see you next time around. We're going to move on then to next item on the agenda, which is updates from the city of Winnemucca wastewater testing for COVID-19. And this is a presentation from Winnemucca City Manager Alicia Heiser to provide information regarding ongoing wastewater testing plans and results as it relates to forecasting the outbreak of COVID-19. This is informational. Alicia, are you out there?
Yep, I'm here. Good morning.
Good morning.
I'm gonna start just by giving a brief summary of the program in general, and then I'll talk about our most recent results. So can everybody see my screen now, which is a map of the city?
Yes.
Okay, so this is how we get 5 test kits per week from a lab in Tennessee. It's called Pace National Laboratory. And those 5 samples, we typically we get the test kits on Friday, and we usually sample on Tuesdays. And so those 5 kits, one is taken at our wastewater treatment plant, which you actually can't see. It's way over here to the left. One is taken at our pump station, which is this IPS National, and it isolates the West National, East National, and kind of Highway 95 area. We take a sample behind Ron Seed, which isolates Wormouth subdivision, Railroad subdivision, Skyland subdivision, and then a little bit of Offenhauser also goes in that direction. There's a manhole at the top of Highland where the wastewater is split to go down Highland Drive and down Hanson. So this Offenhauser area is a little bit unique because some of it goes into this pink area and some of it stays in this orange area. We take a sample at Bod Street over near the junior high, and that is all of this pink area feeds into that manhole. And then we take a sample near the high school. It's actually at the corner of Quincy Canyon and Granada, and that's this yellow area, which includes the Patrician subdivision, as well as Stewart, Paiute, Frontier, and Great Basin area. We take those samples on Tuesday mornings. We overnight them to the lab. Sometimes we have results by the end of the week. It's usually preliminary at that time. We almost always have them within a week, so by the following Tuesday. Unfortunately, this week there was some shipping delays, so we didn't receive our test kits until yesterday. So the sampling this week took place this morning instead of on Tuesday. So we'll be a couple days delayed on results for this week's. Now I'll go to our most recent results, which I think I have to stop sharing and then reshare. So let me see if I can figure that out. So now I hope everybody can see a graph. This is the graph that I've been tracking, and the orange line is our SARS-CoV-2 RNA concentration, which is the viral RNA that results in, well, that is shed, I guess, from infected people. And then the blue line is our 7-day average for cases per day. And those are the results we received from HGH, Golden Valley, all of the testing facilities. And at first glance, it sort of looks like the orange and blue lines are perfectly on as far as spikes and valleys go. But it's actually the orange line, we believe, is about 10 to 14 days ahead. So, you know, this valley, this was when we had very few cases. And so these are actually corresponding to this valley. And then this smaller peak corresponds to this peak in the blue line, and so on. This valley to this valley, this peak to this peak. So like Dr. Stringham mentioned a couple weeks ago, a sample we took on October 13th, I believe, we saw very high concentrations in the viral RNA at the manhole behind Ron Seed. And so Nicole put together a great flyer that we distributed to all of those people. And then the following week, we actually saw a decrease in the total viral load, but it was more spread out across the city. So like Dr. Stringham said, we feel like the virus became more diffused at that point, more scattered around the city, but at a lower concentration. And so that's kind of the decrease in cases per day that we're seeing right now. And so we hope that this trend continues. Like I said, we haven't received any results for this week, so I can't say whether we're going to go back up or keep going down. But so far, this tool has done a pretty decent job at predicting whether our caseload is going to go up or down in the following week. I think that's kind of all the information I have, unless anybody has any questions either about the program in general or about the results we're seeing.
Alicia, this is Commissioner French. I had a quick question having to do with the spike in RNA that we saw at the Ron Seed manhole. Did that result in a corresponding high positivity rate in that particular area? Can we track that fairly close? Is that pretty much a linear relationship?
I do not have any information about where positive cases are actually located. So I have the wastewater data, but as far as when the hospital has a positive case, I don't get to know any of those cases' addresses or anything like that. And so I can't really say whether the spike in the concentration behind the Ron Seed supply corresponded to a spike in cases in those exact areas.
So am I understanding then that just from a HIPAA standpoint, the health board would not have access to that data to try to draw a correlation on that, or am I right on that? Or
yeah, this is Wendy Maddox for purposes of the record. You're exactly right. It has to do with HIPAA, and I can't remember the exact NRS. Maybe NRS 439 talks about confidential information and related to an infectious disease or a communicable disease. Thank you.
Okay. I was hopeful that we would be able to draw a correlation on that. Apparently we can't. With regard to the approximate 700 flyers that were sent out and were posted, did we have much of a response back from those? I didn't hear anything personally from anybody that received one of those. I was wondering what, from a community standpoint, what kind of response we had with that.
We only received one phone call at City Hall. It was that somebody was worried they had either received misinformation or misunderstood the information that they received. They thought that the coronavirus was in the water, and we were telling them not to drink their water, and that's absolutely not the case. It's only in the wastewater, and the viral RNA that is shed most studies are showing that that is not contagious or anything like that. So there's no way that that people are going to catch the coronavirus from the wastewater or because of this testing program. But we only received one of those calls. Nicole may have some more information about it, response on social media or something if there was any chatter about it.
You know, as, can you hear me okay?
Yes.
Okay. So the most response we received, I was out with the small group of volunteers, and we hit, there's quite a few apartment complexes and mobile home complexes within that area. And so we just received a very positive response as we went. People were very intrigued by it and not at all fearful. Between Dave and Dr. Stringham and Alicia and me and Dr. Jensen and others that were involved, that was a fear that we had, was we didn't want to alarm people. We wanted to arm them with information, and people really took it that way. I was happy with that. On social media, there were just a couple of people, but to be honest, they're the couple of people that are always not very approving of anything COVID related, and so I didn't pay much mind to that. But they, thought it was a ridiculous program and on and on. But Alicia could tell you even more that the data on this is so interesting, and I was reading about one college in particular, because they had that lead. They were able to clear an entire dormitory, get those kids sent and taken care of before an outbreak happened at the university. And so anyway, really great data. Thanks.
Yeah. Great. I appreciate it. I was curious about that. I just wondered, I hadn't heard much in the community about it. And I think it's a great program. I think it's an awesome tool. Any additional questions for the city manager on this item?
I have a question. This is Patricia Tyndall for the record. And the question is, what did the flyers say to people? Were they saying, wastewater has found elevated levels in your area, please be really careful and wear a mask? Or what were the flyers telling people?
So
Yeah,
Patricia, this is Nicole.
Oh yeah, go for it.
So the flyers at the very top, they provide just a very brief, very similar to what I read during my report, a very brief idea of what the program is. And then we just had a couple of sentences that high concentrations had been found in the vicinity of their domiciles, and just wanted them to be watchful of symptoms. And then we gave a little box down one side of what those symptoms might look like, and then a box on the other side with the testing locations in our city. And then at the very, very bottom, we provided the city's phone number, so if they had questions, they could call Alicia, or also our COVID email, so they could email through the county and we could respond that way too. And so that was just English on one side and Spanish on the other side.
Excellent. That sounds great. I am really hopeful that if anything ever happens in my neighborhood, I'll get that, and then you can sort of amp up your vigilance, I guess.
Absolutely.
So thank you.
Great. Patricia, did that answer your questions pretty much?
Yes, it did. That was great. Thank you.
You bet. You bet. Any additional questions? Okay. Dr. Stringham, I see your hands up on here. Did you have something to add to this?
Oh, no, I just, my hands are on the table. I'm not sure if I may have inadvertently triggered the question system, but if anybody has any questions for me, I'm happy to answer those.
Great, great. I'm not seeing any additional questions, so I guess we'll just go ahead and move on to the next item. This is approval of the high-risk mitigation plan, consideration, discussion, possible action to prepare and approve a plan to mitigate the county's status as a high-risk county for COVID-19. And Dave, I'm going to pass this to you unless there's somebody else that we need to talk to on this item.
Hello, Commissioner French. This is Abel. Dave had to leave for another meeting, unfortunately, but
Okay.
he did want me to pass on information that we're waiting for more data from the state to come down to see where Humboldt County is at as far as infections. But we are working on the plan, and that data is going to really help us determine the course of actions that we're going to take. So we continue to develop that plan, and we'll refine it as more data comes out from the state.
So for today, then, Abel, this is an item that we need to table then?
That is correct.
Okay.
Mr. Chair, this is Sheriff Allen.
Go ahead.
I just have one comment on that. Just going off of the report that Dr. Stringham put in there. Although I believe Nicole said that there are 177 cases reported in Humboldt County, I believe was what our number. But if I'm understand right, but there's only 27 active cases. Is that correct, Dr. Stringham or Nicole?
That is correct, Sheriff.
Okay. And that could play an important part on the mitigation plan, I believe. So that's all I have.
Absolutely.
Okay, so for today, I'm guessing then we probably don't need to take an action on it. Wendy, do we need a motion and a second with regard to tabling this item?
It's completely up to you. I like to have a motion because it helps the clerk kind of follow along and read, but it's not required.
Well, I'll go ahead and we'll start that way. Do I have a motion and a second for tabling this item?
This is Commissioner Bell. I'll make a motion to table the item.
Sheriff Allen, make a second.
Okay, we have a motion and a second. Any discussion on the motion? All in favor, say aye. Aye.
Aye.
Any opposed? This motion carries unanimous. So we'll go ahead and table this item for a couple of weeks. Future agenda items. Do we have any future agenda items from board members?
None for me.
Okay.
None for me.
Okay, so we'll just go ahead and stay with the protocol that we have in play right now then. Not hearing any additional future agenda items. We'll move on to the next item, which is public comment. And this is the second public comment. General public comment is designated for discussion only. And public has the opportunity to address the commission on any matter not appearing on this agenda. However, no action may be taken on the matter raised until the matter itself has been specifically included on the agenda as an item upon which action may be taken. So do we have any additional public comment today?
This is Patricia Tyndall again. And I'm sorry, I wasn't able to zoom into the meeting when it started, so I missed some information. Has anybody talked about the immunization or like a vaccination for COVID? Is that on the agenda at all, or is there any information about that, planning for it? I was in an Immunize Nevada meeting yesterday, and they had a lot of information about how to deploy the upcoming COVID vaccination. Just wondering if there was any information about that in the meeting.
Patricia, I can give you a little bit of an update as to what I heard today. Dr. Stringham answered a question regarding vaccinations and the protocols with regard to that. He's tracking this on a daily basis right now. As far as a specific date, and there was nothing offered at this point. He did mention that there was some minor setbacks with regard to the human testing side of it, and a couple of the companies are working through that right now. It appears then that the governor's plan for distribution of the vaccine is probably what we'll be falling back on once the vaccine an approved vaccine is available. And I guess Patricia, I think probably the best piece of information for you would be to obtain that plan, that distribution plan from the governor's office that give you the specifics of how and where that the vaccine will be distributed when it is made available. Does that
Okay,
help
thank
at all?
you. Yeah, that does. They were just talking about rural areas across Nevada and 75 miles from a CVS or Walgreens, and it had a lot of details, and it would appear in this meeting that this group level was planning something quite imminent, which surprised me. And I wanted to make sure that Winnemucca was like included in there. So anyway, I will get with Dr. Stringham and see if there is any information that we need to pass along to my high-risk seniors, basically. So thank you for that.
Dr. Stringham, did you have anything to add to that that response?
No, I was very impressed by your ability to remember in detail what we talked about. So that's is pretty awesome. No, I think that, Patricia, what I would tell you is that what you're hearing primarily is the infrastructure aspects of the vaccination distribution system that's come up with. And I think that in the end, the vaccine really is still in process at this point. So I think the best of news will come from the private sector, various companies that are working on this. And I would anticipate that we'll start hearing some pretty good news here in the next 30 to 60 days about where vaccines are at in terms of coming out fairly quickly. My best guess would be 90 to 120 days to actually start vaccinating, but I'm absolutely speculating.
Great,
Okay.
thank you.
Thank you.
You bet. We have any additional questions from the public? Anybody on the phone, *6 your phone and identify yourself for the record, please. Okay, not seeing any additional public comment. I'm going to adjourn this meeting. Is somebody else on? Okay.
I think that was some feedback.
Going to adjourn this meeting at 10:17 a.m. Thanks, everybody.
Thank you.
Thank you.